So good evening, everyone. My name is Morgan Hamlin. I am a team member on the Strategy and Marketing Department here at VCU Health. Thanks so much for joining this community webinar, A New Normal with COVID-19. So we are recording this webinar and it will be available in the coming days. So as discussion continues about how to reopen our workplaces, our businesses, schools, and other public places, what do we need to do to keep safe during this pandemic and into the future? And I have the privilege of introducing tonight's speaker, VCU Health infectious disease expert, Dr. Gonzalo Bearman, to discuss what we have learned and then what we can expect in the days and months to come. So Dr. Bearman and I are going to talk for about 15 minutes or so. And then if any of the attendees have questions, please feel free to submit those. At the bottom of the screen, you'll see a Ask a Question button. Feel free to submit those there. So with that, I'm going to get it started. So Dr. Bearman, this far into the COVID-19 pandemic, what have we learned?
Hi, good afternoon, everyone. Thank you for having me on the call or the Zoom conference. So I think we've learned a lot of things over the course of the last 3 months. Number one, that the issue is still evolving, and we're going to get to that shortly. Number two, that transmission is still predominantly through droplets, but there is concern about transmission from asymptomatic people to others, and that's something that's certainly a reality. It's not the majority of cases, but it certainly exists. We've learned also that the elderly and those with chronic medical conditions are disproportionately impacted, as are minorities and people living in crowded environments. But we're also learning that pediatric cases can have some unusual severe manifestations too, not with the frequency of older folks, but certainly something that can't be overlooked. We're also learning, and I think this is probably a really important take-home point, is the importance of testing capacity, and tracing by public health authorities. And last but not least, the critical importance of personal protective equipment, not only for frontline providers and healthcare workers, but also for the community. Of that, I'm also referring to cloth masks. So it's kind of those are the big things. The last thing I would say is that we've learned that aggressive measures such as social isolation, quarantine, shutting down businesses, schools, etc., have effectively flattened the curve, such that we have not had a massive rush of patients come into the hospital or hospitals. We're getting a steady stream, which certainly keeps us very busy, but does not overwhelm the healthcare system, and that's critically important. That's what's considered flattening the curve, making the wave or tidal wave of patients much flatter, such that it's much easier, to deal with at the individual level here in the healthcare system.
I think it brings up a great point to go into my next question. So social distancing, is that still important along with wearing a mask when you're in public?
Yeah, so that's critically important. And as I've said before, and I apologize if those have heard me say this already, I tend to repeat myself sometimes. There's really 4 critical pillars of responding to a pandemic. Number one is having testing capacity to make the diagnosis. As we all know, we were woefully underprepared as a country months ago. We're getting better. We're still not where we're supposed to be. Number two is appropriate treatments or therapeutics. We have some promising or potentially promising drugs that are in the making or being tested, but we certainly don't have any absolute treatment that's been identified, FDA approved, for not only treatment of disease, but also for prevention or prophylaxis. We don't have that at all. Number 3 is a vaccine, which we all know we don't have. So number 4 would be the non-pharmacologic interventions, and that's what we focus on, which is social distancing, quarantine, maintaining 6 feet distance, washing hands, wearing personal protective equipment such as masks. Those are critically important, and those have essentially resulted in flattening the curve, as I mentioned already.
So if you could look into your crystal ball, what do we expect next for the virus?
So my standard response is the crystal ball is fuzzy. But I think what we're now seeing is we've gone into the phase, I'm going to call this kind of the slow burn phase of COVID-19. My experience, or our experience here at VCU Health, is we have cases every day. We have a fair number of hospitalized patients, but not massive amounts coming in. Seems to stay at equilibrium. So we're going to see continued ongoing community transmission. As social distancing things are liberalized, or as we go back to more life as pre-COVID-19, expect to see some bumps or increases in the rates of infection. Hopefully, as we do things in a staged manner, these bumps don't become another curve or push or wave of patients. They tend to be just little bumps on a kind of steady amount of COVID-19. I can see that happening for months. So it's not even close to being over.
So I guess that's what our new normal, as people are saying, is going to look like. This isn't going away, and we should expect, like you said, those spikes to kind of come in the future.
Right. I think for a pandemic, or for things to stabilize or almost go away or come down to a level which it's not as noticeable anymore, we have to reach the level of herd immunity. And herd immunity is the concept that you have 60, 70+ % of the population immune to an infectious disease, so that you don't have a massive amount of transmission. The only way to get to that are two ways: that enough 60, 70% of people get infected and do well and survive, et cetera, or vaccination. Vaccines, that's what we do. That's why we have measles, mumps, rubella vaccines, chickenpox vaccines now, et cetera. That's how you prevent massive outbreaks of those diseases. We don't have a vaccine developed yet. It might take 12, 18, 24 months to have a vaccine tested, confirmed, proven that it's safe, and then developed to scale to be administered across the country or even worldwide. So this will be an ongoing issue for months, if not a year.
So then shifting gears a little bit to VCU Health. I know there's been a lot of talk about people having some apprehension about coming in to VCU Health if they need to receive care. Can you talk a little bit about what VCU Health is doing to ensure that our facilities are safe for folks to come in should they need a care?
So VCU Health is absolutely positively open for business. We're here to take care of patients no matter what your medical condition, and we can do it safely. To date, we've had no healthcare or hospital-acquired infections of COVID-19. So that's really good. But more importantly, I'd like to underscore kind of the things that we've put in place, or the measures we've put in place, to minimize the risk of COVID-19 to our visitors and to our patients who are not infected. Number one is, we have universal testing on admission. So obviously, if someone has symptoms that are suggestive of COVID-19, they're tested. That's called a person under investigation. The other side is called COVID-19 screening. So someone comes into the hospital or to the emergency rooms with symptoms that are not COVID-19, for example, a fractured ankle or a motor vehicle accident. We still screen that patient for COVID-19 to make sure they're not harboring or manifesting early infection to put others at risk. We have the majority of our patients in single occupancy rooms so that you're not having roommates. Roommates are only going to happen with patients who do not have COVID-19 on screening. We also have pre-procedure screening. So if someone or a patient is coming for an elective procedure, an elective surgery or some sort of invasive procedure like a colonoscopy, we're doing pre-procedure screening 24 to up to 72 hours prior to the procedure to make sure they're not infected. Other measures that we've taken that are aggressive but we feel appropriate are for terminal cleaning of a room. That means when a patient has left the room to prepare for the next patient, in addition to the aggressive manual or hand cleaning that's done, we now use the UV light robot for that room also to make sure we maximally clean the environment, kill the bacteria, the fungi, the viruses. We've switched over to virtual visits as much as possible for those people so that they can have their visits through not just 8 to 4, 9 to 5, but expanded access, even exploring even weekend hours here and there to increase the access. And last but not least, we're really doing our absolute best, actually very aggressively encouraging and really promoting social distancing even within waiting rooms. So we're staggering patients such that there's no crowded waiting rooms. And when patients do arrive, they're given a mask to wear at all times, and the healthcare workers wear masks at all times. So it's called universal mask use in the environment.
That's great. We've actually been getting some questions coming in kind of around the herd immunity. So I'm going to try and combine these kind of into one. So
Sure.
Essentially, a couple of these questions have asked, so getting the virus and then getting over it could make me immune. And I know someone also asked, how do you know when you're over? Like, how do you know when the coronavirus has passed?
So let's start with the concept of immunity post-infection. So we still don't know enough about this virus like we do others. For example, if someone is infected, like many of us were pre-chickenpox vaccine, pre the varicella vaccine, like myself, I'm immune to getting chickenpox again. So that's the classic, you're infected and then you're immune to reinfection. We don't know if that holds for for COVID-19. It's not very clear. So if someone is sick and recovered, or sick and confirmed to have antibodies by serology tests for COVID-19, we don't know if that confirms an immunity for reinfection and for how long. Now, the second question, I believe, was regarding how do you know you've recovered? Was that right?
Yes.
Yes. So there's really two ways to assess recovery or post-infectious, or really removal of isolation or transmission precautions. Number one is that the patient, an individual, is 72 hours post-improvement of symptoms and 72 hours fever-free, then you're off to the road to clinical recovery. The second is not only that, but also having 2 negative nasal swabs or PCR tests for COVID-19. That's done when patients are being placed from a hospital to a long-term care facility, which we've all learned are areas that can be of really high risk for COVID-19. That's the other way to confirm that the infection has run its clinical course and resolved.
Great. Another question that was submitted, someone asked the question, have you researched vitamin D in terms of its possible role in strengthening an individual's ability to fight off COVID-19 when contracted? And any thoughts to help elderly populations in strengthening their immune system during this time?
So there's multiple questions there. So the first is vitamin D has not been a focus of research. Vitamin C at high doses, very high doses intravenous, is a focus of research pre-COVID-19 and also ongoing here. Too soon to tell what the outcome is. I can't give you any data-driven response on that. The second was advice for elderly. Is that the second question?
Yes, elderly populations strengthening their immune systems during this time.
I think for elderly populations, what's critically important is that those that spend time around the elderly are super sensitive to their potential concerns. Therefore, I would say for elderly, to the extent possible, to avoid crowded environments, to the fullest extent possible, wear face masks, whether they're cloth or paper face masks, to practice hand hygiene as much as feasible. And those are the big common sense things. Now, for strengthening the immune system, there's no magic pill as immune modifying or immune strengthening intervention. However, important things to do. I say this first because I feel obligated as a physician who practices medicine still say this, is if you smoke, quit smoking. Please, that's the worst thing you can do for any respiratory virus, is to continue to smoke. Number two is to get enough or adequate sleep. What's adequate? Well, it depends. Some people 6 hours, some 7, some 8, some 9. You have to know your body on that because that does have an impact on your immune system. Number three is to stay hydrated. That's critically important. Number four, to minimize or avoid alcohol as much as possible because those are immune depressants. So those are important things to consider. And of course, is to have a balanced and nutritious diet. Last but not least, to get as much exercise as you can tolerate. We all know that's an immune booster.
Yeah, I know I've seen a lot of people out for walks, which has been great.
Great idea.
Next question. So if someone is a part of the high-risk group and lives with a transplant recipient, will it be safe to start going out when restrictions are lifted as long as a mask is worn and you keep a safe distance from people? I'm assuming this means high risk, like low immune. I'm assuming that's what their question was.
Yes, it's a little unclear on that question if it's safe for the transplant recipient or safe for the other individual in the house. What I would say is that there's always a little bit of risk. We don't live in a risk-free world. However, we certainly don't want people to be so isolated they have no contact with others whatsoever. So hand hygiene, critically important. That 6 feet social distancing is critically important too. Respiratory droplets tend not to travel greater than 6 feet. They can in some situations, but not commonly. And last but not least, wearing some sort of a mask, a paper mask or a cloth mask to minimize those droplets going into the nose or the mouth mucous membranes, which is a mode of transmission.
Great. Another question, this is looking at VCU Health. Is VCU Health collaborating with the academic campus administrators to advise them at what point would be safe to open campus and what precautions will be required?
Oh, absolutely. So that's a huge area of focus for President Rao at VCU and has involved VCU Health staff. And there is a process that's being developed right now. And I certainly have been consulted as an infectious disease specialist on how to address some of the infectious disease matters, but it goes beyond that, of course. There's a lot of logistics. So it's a well coordinated, ongoing process that we hope to have live by fall of 2020 to get the students back on campus in some way, shape, or form.
Great. And then this is a fun one. With summer coming, is there a safe way to enjoy the pool?
Well, I guess, well, I would first say that we have no reason to suspect that COVID-19 is waterborne. Okay, so it's not aquatic. Even if it were waterborne, chlorine in a pool or the salinated pools would be sufficient to kill the virus. We believe that would be the case. I think to enjoy the pool properly, you still have to do the best that you can to respect the social distancing, 3 to 6 feet apart. If you can wear a face mask as much as possible before you hop in the pool, that would be great. And hand hygiene would be important too. Perhaps try to limit sharing things such as drinks, utensils, whenever there's common eating around the pool. So those are the kind of common sense interventions I would recommend.
Perfect. And then someone just skipped through summer. Do you see public schools opening in the fall?
That's a good question. I don't entirely know. I think that it's a very important issue for us on many levels. Certainly don't want to deny the educational opportunity to youngsters, and not everyone can get education at home or even have internet access to do the online kind of education that would be required. So what I would say is we need to look at every possible option to make an opening of schools, public or private, feasible either in a stage matter or in a hybrid matter. Sometimes coming to class with lower number of students, alternating who comes to class with some hybrid learning done online. So I think we have to be very creative that way.
Great. Another good question, is it safe to continue with appointments such as visit to the dentist, or should I wait a couple more months?
Well, I think it's safe. If you need, let me just back up. If you need dental care and you have an urgent dental matter, I would go ahead and do that. Certainly, if you feel more comfortable putting off a routine cleaning for a couple of months, or even up to 3, even 6 months, if you want to go that far, that's probably okay. The risk of going to the dentist is probably greatest for the dentist and not so much the patient. So dental practices are doing their best to maximize safety in that respect. It's impossible to wear a face mask and get dental care. We don't understand that. So dentists are being very aggressive with that. Here at VCU Health, our plan is to have our dental service up and running in the very near future.
Great. And then another question in related to surgery. So when you say surgery patients are screened 24 hours pre-op, are you referring to the PCR swab test or just questionnaire concerning possible COVID contact?
Right. So I'm going to speak for VCU Health. Okay. So because I'm not going to speak for the other healthcare systems in Richmond, Virginia, we protocolize, screening for elective procedures 24 to 72 hours prior. That includes screening for symptoms and a nasal PCR test. So it's both. Our goal is to have maximal safety, not only for the healthcare environment, but also for the patients. Although it's not been well studied, it's almost certain that if someone goes in for an elective procedure, such as a bypass or even an elective knee or hip replacement, if they are in the early stages of COVID-19, they almost certainly cannot have a better outcome by having COVID-19 with that procedure versus not having COVID-19 and having the procedure. So it's really for the safety of both the healthcare environment and for the patients.
And that's great. That actually goes into a question which I'm just going to summarize, and you can correct me if I'm wrong. So if someone came in, say for cardiac, they would be kept in a separate area. They have no worries of being in contact with someone that has COVID in VCU in our facilities.
Right. So we've been very thoughtful in making sure we have units that have where the COVID-19 patients preference to go. There are certain like acute care or medical ICU units where those patients preferentially are admitted and cared for. The important thing here is that all the patients in that level of care, including cardiac or post-cardiac care, are in single occupancy rooms. So the transmission from room to room is going to be next to nothing or nil because of the single occupancy. And the healthcare workers taking care of those patients are essentially focused on the COVID patients and not taking care of the non-COVID patients at the same time. So we're focusing not only our healthcare worker effort on the certain patient populations, but also having the spatial and physical separation between the rooms and the patients.
That's really reassuring. Another question, and I know we've talked about this a couple times, but what about grandparents being around young grandchildren or just gathering with your family kind of as we kind of start to this reactivation standpoint?
Right. So this is a common question. And again, we don't want to take away people's quality time together and the human touch and families spending time with loved ones, grandparents, and grandchildren. But what we need to do is try to be as thoughtful about it as possible. So again, spend time with the grandchildren, but stay 6 feet apart. I know it's not easy to do, but it's probably better safe than sorry. In addition, wash the hands before any sort of encounters or touch. In addition, wear the masks, and I think grandchildren have to do their best to wear the masks around grandma and grandpa to keep them safe. In this situation, the one who's at greatest risk is obviously the grandparents and not so much the kids. So it's really something that's done for the safety of the grandparents.
Great. And then another question that came through, how likely is it for the virus to be transmitted through the HVAC system?
So that's exceedingly uncommon. In fact, there are really no good published reports to suggest that that happens. It is a droplet-borne process, usually 3 to 6 feet. There are aerosols sometimes, but that usually happens when patients are undergoing aerosol-generating procedures, like having a breathing tube put down the throat to the lungs, having a bronchoscopy, which is a special test going down to the lungs, having an endoscopy or something going down into the mouth by way of a scope. Those are aerosol generating procedures, or being on a ventilator. That's an aerosol generating procedure. Other than that, the droplets don't travel more than 3 to 6 feet and are usually not propagated through the HVAC system. So very unlikely.
Good. Woo! I've seen a couple other questions come through, and I think maybe you probably repeated yourself on other forums, but it would be great to know. So if someone thinks they might have COVID, what are some indicators they could look for if it, or how many patients have you seen that maybe don't have a temperature? Is temperature the only indicator? And then when should someone go and get tested?
Okay, so multiple questions there. So in terms of symptoms of COVID-19, concerning symptoms would be fever, chills, headache, muscle ache, sore throat, congestion, basically anything that feels like a worsening cold, or worsening cold or a flu-like symptom. To be included also are diarrhea or some gastrointestinal symptoms. That may be a symptom of COVID-19, albeit an uncommon one. Now, in terms of patients who are COVID-19 positive or infected that have minimal or no symptoms, our experience here at VCU Health, having screened over 1,000 plus people already in the last couple of weeks, these are people who did not have symptoms. Our positivity rate is really low, like 1%. So in other words, over 1,000 plus people that have been screened that had no symptoms but were coming to the healthcare system for other issues, roughly 1% of COVID-19. So you're more likely to have symptoms when infected with COVID-19.
Perfect. Thank you.
Yeah.
And then how dangerous is it for small children to play together in the neighborhood in regard to their health and the spread of disease?
So there's always a risk. However, with children, we're learning that COVID-19 is almost never as severe as with adults. There have been some few reports, these are very scarce and few, of patients young children getting infected and having a severe inflammatory-like reaction afterwards or during the course of infection. That's not the norm. So there is risk. I understand children, particularly when they're really young, it's hard for them to wear face masks all the time, wash their hands, not touch their eyes or mouth, et cetera, et cetera. So probably best that they play together, supervised, and that parents be mindful and be watching for situations in which there's a lot of close contact, urge or push the kids through hand hygiene, and if the child is old enough to wear a mask, if that's feasible.
Great. Another question that's coming through. So what are your thoughts on wiping down, say, UPS and FedEx packages that you have delivered?
Yeah, so what we're really talking about now is transmission by contact. So the primary mode of transmission remains droplet. Contact is real but small. Certainly, it is not a bad idea first to wipe down or disinfect high-touch surfaces. So keyboards, remote controls, where you eat, dining room tables, mobile phones are very high-touch surfaces. If those can be wiped down, great. Now, in terms of cardboard, it's usually depends where you read, but the virus can be on that for 24 to up to 72 hours. It's up to 3 days. It's not a bad idea to wipe it down. It's probably not absolutely necessary, though. But if it makes you feel better, go ahead and do that.
Perfect. We've had a couple other questions come through, but I know we've got about 5 minutes left. So I'm going to go ahead and wrap this up just because I know you've got other places to go. So as we wrap up, I just want to thank you so much for your time. Additionally, thank you to all of our attendees who have submitted questions. These have all been so great. And I think it's really great that we're having these kind of critical conversations around COVID-19 and all that we can do during this pandemic. If you have any additional questions or would like to learn more information about how VCU Health is tackling COVID, please visit our website. It's vcuhealth.org/COVID-19. And as a reminder, this webinar, is being recorded and will be available in the coming days. So Dr. Bearman, thank you so much.
Thank you.
And I hope everyone has a great evening.
Thank you. It's been a pleasure. Good night, everyone.